A main focus of myofunctional therapy is the airway, because if we can't breathe properly, we can't sleep properly. And if we're not getting this restorative sleep, it puts us at risk for heart attack, stroke, diabetes, Alzheimer's, even early death. If you aren't getting rest, you will be getting sick. Now, snoring or noisy breathing is often the first sign of breathing disordered sleep. It's essentially the sound your body makes when you're struggling for air. If you were making this sound all day long, if you were snoring as you were going about your day, someone would ask you if you were okay. But when it happens at night, we just chalk it up as something normal. Well, it's common, but it's anything but normal. What happens at night when you lay down is those muscles and soft tissues of your neck relax. If you already have a small airway, or if your tongue sits low and back in your mouth, or if you're a mouth breather, this is a concern because that airway is going to become more compromised. The spectrum of breathing disordered sleep ranges from snoring all the way through to obstructive sleep apnea. Now, the American Academy of Sleep Medicine defines an apnea as the cessation of breathing for at least 10 seconds. Now, think about this. If you go in for a sleep study and you only stop breathing for 5 seconds, 8 seconds, it doesn't count. Now, you might still be struggling to breathe, but until you stop for full 10 seconds, it's not considered an apneic event. And for someone to be considered severely apneic, they have to have 30 or more of those events every hour. That's an enormous amount of lost oxygen during your sleep. So we want to know more than just, do you have apneic events? We want to know, what's your sleep look like? The cool thing now is that we have sleep rings that you can wear, and these will track your pulse rate, they'll track your oxygen, and so we can see, is your sleep disjointed? Are you being disrupted throughout the night, and is your oxygen dropping? We know that if your oxygen level's dropping, your airway is compromised. So if you're having snoring issues, if you're having sleep issues, if you have signs and symptoms of obstructive sleep apnea, talk to your myofunctional therapist. See about getting one of these screenings or a sleep study. Really find out what's going on. If the underlying cause for your snoring or your breathing disordered sleep is a weak tongue muscle, a low postured tongue, or mouth breathing, myofunctional therapy might be able to help you get a better night's sleep.